My name, my name is Dr. Rachel Vreeman. I am a pediatrician and I'm the director of the Arnold Institute for Global Health at Mount Sinai in New York. And it's really our privilege as a global health institute to be able to have deep, specific partnerships promoting global youth health. And we're so excited to be able to consider the needs and issues of youth around the world today, as we're marking International Youth Day. As many people joining us may know, in many parts of the world, health services for youth are particularly lacking. Often we do a much better job with very young babies and children in terms of making sure they get their vaccines and have checkups and things early on in life. But often, once you reach an age above 4 or 5 years old, all the way until adulthood, there may not be a place in the health system for you. That means that even having regular checkups, having a place where you might be able to also get vaccines you need, being able to access services, whether for mental health support or sexual and reproductive health support, or anything that you might have in terms of a health need along the way, can be really, really difficult. I'm incredibly privileged to be able to introduce to everyone joining us today some of our partners from Kenya who are on the forefront of growing a model for how we can provide better health care and better health support for youth. They are in particular revolutionizing a model for adolescent and youth healthcare in Western Kenya, and really excited to highlight what they're doing today. Mount Sinai's School of Medicine and the Arnold Institute for Global Health are privileged to be part of a partnership with Moi University's School of Medicine in Eldoret, Kenya, and the Moi Teaching and Referral Hospital in Western Kenya. This is part of Kenya's public health system, part of their national system with one of their national referral hospitals and one of the largest medical schools in Kenya. And among the health initiatives that the Moi Teaching and Referral Hospital and Moi University are pioneering in Kenya are a model for adolescent and youth healthcare. We've been delighted to be able to partner with them in this effort, including their efforts to grow a center for adolescent health, a center of excellence for adolescent health that they call the RAFIKI Center in Eldoret, Kenya. And in addition to growing this specialty center to really be kind of at the top of what's providing adolescent health care in Western Kenya, they're also more and more working to partner with the Kenya Ministry of Health and with other health centers around what it looks like to provide services in those centers that are friendly and welcoming to adolescents and youth. So we get to learn much more about this today as we celebrate and honor and think about International Youth Day with this. I'm delighted to be able to be joined today by three different leaders in adolescent health services in Kenya who are going to be talking with us today. We have Hilda, who works as an adolescent peer mentor, someone working with adolescents and young adults in the healthcare center in Western Kenya at what we call as I said, the Moi Teaching and Referral Hospital Rafiki Center of Excellence in Adolescent Health. She also chairs the Adolescent and Youth Advisory Board at the Moi Teaching and Referral Hospital and is currently doing her undergraduate work in counseling psychology. In fact, we're delighted to note that Hilda is anticipating that she's going to be graduating with that degree in September. So we're cheering for her in advance and so excited to have her with us today. We also have Victor joining us from Kenya today. Victor also works as a peer mentor who supports the adolescent health services at the MTRH Rafiki Center of Excellence in Adolescent Health. He is one of the champions for the Rafiki Center's Operation 000 program, which is particularly trying to partner and support youth who are living with HIV in the challenges of reaching full viral suppression, and with that, having full and complete health in their lives with HIV. We'll hear more from Hilda and Victor in just a moment. We also have joining us from Kenya today, Dr. Edith Apandi, who is a pediatrician on the faculty of Moi Teaching and Referral Hospital in Eldoret, Kenya as well. She has been involved in growing the clinical care services for people living with HIV in Western Kenya since 2005 as part of this collaboration that Mount Sinai and other North American institutions are in partner with Moi University and the Moi Teaching and Referral Hospital. We call this collaboration AMPATH, or the academic model providing access to healthcare. She has worked across the range, first as a medical officer, and then all the way up to serving as the consultant in charge of the pediatric HIV care and treatment program in this AMPATH partnership. She has had quite broad involvement, not only in growing up this HIV care program, but also in working in an advisory role with organizations like USAID across Western Kenya in growing adolescent health services broadly. Dr. Apandi is very passionate about both services and research to support adolescent care and adolescent health in Kenya. She serves as the Kenyan secretary for the Pediatric Research Working Group at AMPATH. She's a member of the Kenya National HIV Pediatric and Adolescent Technical Working Group. She's the lead for research efforts, including serving as a member of the Global Adolescent HIV Prevention and Treatment Implementation Science Alliance, which is funded by the Fogarty International Center at the National Institutes of Health. And we're delighted to have all three of them with us today. Now, before I start asking Hilda and Victor and Dr. Apandi lots of questions, which I'm excited to do and to really highlight their experiences for International Youth Day, the youth that we get to work with in Kenya, as well as some of these leads from this peer mentor program, have created a really special video to share with us today. This video is going to highlight the services and the approach to youth health that they are pioneering at the RAFIKI Center of Excellence for Adolescent Health. And I'm particularly excited about this because it's going to give everyone joining us a chance to see the center directly, hear from the youth, and see this really fun work that they've put together to share with us a better sense of what we're partnering to do to promote youth health in Kenya. So without further ado, I'd like to turn it over for us to watch this video created for our International Youth Day celebration and to highlight these youth health services in Kenya. And then we'll talk more. We can talk about the video. We'll talk about the experiences of everyone joining us. And we also should have time for some questions from those of you joining us as participants today. So let's turn it over for the video.
Okay, welcome to RAFIKI Adolescent Youth Center. Is where young adults youth are found. It's a health clinic. It's a free and friendly place for youth, for clinic. You can have a look inside. Welcome. Yes. And now this is RAFIKI inside.
Yeah, okay guys, welcome. So this is RAFIKI building where we have our RAFIKI flowcharts. You can see it's we have registration, retention here, family planning, triage, radiation, lab services, pharmacy, psychological, nutrition, and social work, and then exit. So welcome. So this is our first where a client starts the registration. As you can see, we have here and a client doing one-on-one session. And also this part, we have youth who are playing football tennis. It's a game starting from 3 p.m. And also after registration, we have she's our nurse and doing triage to our clients.
Okay, this is medication office where we see clients with less weight or malnutrition. When they enter, they get their scale, weight, and height measured, and then the nutritionist will see them here and prescribe them some food supplements. Yes. So their height and weight are just seen here, and then they are given these supplements. Yes. Next is our nurse station. At the nurse station, those clients with high fibroids are given guidance and counseling here how to take their medications. So we can proceed to the kitchen. This is a adolescent kitchen. Here, when someone brings our food or his food, washes them with a microwave and then washes them here. We have a sink. We also have a heater here and our cabinets. Yes, and our jiko here.
Okay, so after nurse finished triaging a client, next step we'll go to clinician. So let me show you. Come on, so clinician room is upstairs. It's a big building, nice one. So it's upstairs. As you can see, we also have a talking walls for gender-based violence. Also, we have for other substances used. So we also have like for youth, and also we have for freshi kiakili, freshi kiafya.
Now, after the client has been triaged, he or she is escorted to the clinician. And this is our clinical office, as you can see. These are doctor and the client, that's the clinician. He or she, he is doing his work as a clinician together with the client. Then after he has written the prescription for the client moves out to the psychological office. This is our psychological office where the counseling of our clients takes place. Then after that, after moving out from the psychological office, we go to our cervical screening room. Here we go. This is our cervical screening room, as you can see. The cervical screening cancer services takes place here. We service our clients, the ladies who are at the age of 18 years and above, with the cervical screening cancer process. It takes here together with the nurse.
As part of RAFIKI, we also have other extracurricular activities, like, for example, we have JCS, we also have football. We have football, We have ducks, but those we usually do it in the field outdoor. When the doctor writes the prescription, the patient usually enters in the pharmacy room. In the pharmacy room, yes, the pharmacist. Then the patient usually gives the pharmacist her prescription. The pharmacist gives the patient the drugs according to what is written in the prescription. So here are some of the drugs usually give to our patients. We have ARVs, most of them are ARVs.
Okay. After all the activities in the clinic, we also have other outdoor activities. Can come with me. So as you can see, here's our farm. We normally plant and we engage our youths in training them how to farm so that they can sustain themselves economically. And if you come closer, you can see the vegetables that we have actually managed to plant.
Everybody, let's go! Everybody go down, 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 down. Go down. Watch out! Dance move and take over the street. Everybody a move to the beat. And the dancer bring you the street. In a canyon we're so sweet. Dancer. Let's get down to business in a Jesus way right and wow. Bolo bom 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 bolo. Bolo bom 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 bolo. Bolo bom 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 bolo. Everybody. Party, everybody out.
Thank you so much. And thank you to everybody who put that together. And again, thanks Hilda and Victor for joining us today, as well as for your roles in what's going on at Rafiki in this way. We really are delighted to have given everyone a chance to see a little bit of what the Rafiki Center looks like. And all of the services and activities that young people are receiving and participating in there. And it's hard to stress enough how the Rafiki Center is really a unique place in Western Kenya. It's a very special model to have this kind of center with multiple services that are really set aside for adolescents and young adults, and to try to provide the kind of multidisciplinary services as well as activities, training, different supports that we see there. So I wanted to start with a question for Hilda and for Victor. You know, when we think about young people and we think about health and how you're trying to strengthen health for young people in Kenya, I wondered if you could share with us about some of the things you see as the biggest health concerns for youth right now. And maybe you can also, in that, talk about how in your work at the Rafiki Center, you're trying to address some of those. But we'd really like to learn from you what you see as the issues affecting youth's health and their well-being right now. Maybe Hilda, if you are willing, would you start for us? And then we'll go to Victor.
Thank you. Most of the issues that adolescents undergo currently is mental health. To be precise about mental health is about drug and substance abuse, which is the leading actually currently, depression, part of it, and anxiety, and the eating disorders that we have experienced. And for the drug and substance abuse, at least we have tried to bring a psychiatrist on board to help them overcome, and the studies that are currently being undertaken in Rafiki. That is how we are trying to address drug and substance. And also we have a best psychologist in Rafiki who is really helping us a lot in overcoming the depression, the anxiety, the eating disorders, and also part of it of the drug and substance. Yes, that is how we have tried and managed to overcome the mental issues that adolescents undergo currently.
Thank you. That's really helpful. And considering how we can better respond in Kenya and globally to the mental health needs of youth, including, as you said, substance use and so on with that. Victor, other thoughts from you about health concerns for youth right now and things that are needed in that response?
Yes, and I've viewed that most of the Kenyan youth, especially adolescents living with HIV, get this problem of disclosure. Most of the adolescents don't know how to go about this issue. You find that people will fail to disclose or disclose late when the effects cannot be returned. So at Rafiki, we have tried to provide some solutions, not 100% proof, but we have tried to talk to them on one-on-one sessions to try and give them a bit of survival tactics. Yeah.
Yeah, and I think that's such an important challenge that you're describing, Victor, for children, adolescents, young adults who are living with HIV, the phases of disclosure that the clinical system tries to walk along with them in. First, of course, learning and being disclosed to about their own status as children and young adults learn what it means to be living with HIV, and then the ongoing challenges, as you've said as well, of making decisions about when and how to disclose their status to other people, especially knowing that those who are living with HIV are still facing in Kenya and in so many parts of the world, lots of stigma, discrimination related to having an HIV infection that they're living with in that way. I think that is, as you've said, such a really critical challenge, a big challenge, and also something that you're helping people to walk through as well in that. And we'll come back in a moment to sort of talk about some of that specific role that you play at the Rafiki Center and in the health system with that as well. I guess I didn't say, none of us said, I know we have some joining us who do not speak Swahili. The word Rafiki means friend in Swahili, and this really is a place that they're trying to not only create a friendly presence, but to also be friends in these really important ways to youth across whatever their health needs might be. Dr. Pandey, we're also so happy to have you joining us today for this discussion. Could you maybe tell us a bit about how you, as a pediatrician in Kenya, have become an advocate for growing adolescent health services in Kenya?
Thank you very much, Rachel. So in my path towards my interest in adolescent health, when I first graduated as a new pediatrician, I came to join the AMPATH program, which is an employer that I was in before I went for my postgraduate. And so when I came back, I was absorbed back in as a pediatrician. And one of my first tasks was to be able to support the program to tailor some of the services that are provided towards adolescents. At that time, the HIV program was catering for children, and then for adults. There was no programming for adolescents as a population, but it became apparent that most of the children were no longer children. They needed some differences in the approach to their service provision. So I was tasked to be able to support the program to be able to meet their needs. And this included developing a curriculum, identifying staff, training the staff, being able to do advocacy for facilities. At that time, AMPATH was having almost 300 facilities under its care, under its support. And so I was tasked to support the 300 facilities to be able to be adolescent responsive. So this meant a lot of capacity building. It meant developing SOPs and guidelines. It meant supporting the MNE framework to be able to be able to have data that is able to increase the visibility of adolescents. And It also meant budget allocation, advocating for budget allocation for the adolescent population. And so as I continued to support the program through these initiatives, it became clear to me that the adolescent population is neglected in every other aspect of healthcare system, not just the HIV programming. At that time, I was also taking care of children with diabetes. And of course, majority of them were in the adolescent population. And I saw the similarities in what the adolescents with diabetes were experiencing, similar to those with HIV. And so that grew then my interest in adolescent health. Later, we started noticing the gaps in sexual and reproductive health service provision, with the adolescent population having very poor access to maternal and child health services. So basically it just grew, it grew from HIV and then to other chronic diseases and then to maternal and child health, and also as we started seeing the adolescents living with HIV, we started seeing the mental health cases. And so mental health around the adolescent population also became of interest to me. And of course, with the interaction with our North American colleagues from Indiana University and Mount Sinai, I realized that it's actually possible to have adolescent health as an area of focus for a pediatrician. Yeah, and I immediately jumped to that, and I have no regrets. Thank you.
Thank you. I think for as you know, for my own journey as a pediatrician in many ways matches parts of this in that in the early days when we were pediatricians caring for children who were living with HIV, most of the patients that we saw were quite young children, because without the medicines for HIV, children were not living to become adolescents or to become adults. And it's really been the incredible privilege of my career. And I know that you share this over the last 15, 20 years, that we've been able to now see those who are born with HIV become adolescents and adults and move into that new phase of health. So it's really become a privilege in that sense to be able to think about the needs of adolescents more broadly. And of course, to make that transition, as you said, and as you've done for an entire health system with more than 300 facilities, not only to provide better care for those who are becoming adolescents and young adults who are living with HIV, but also to think about those who are living with other chronic diseases like diabetes, as well as a much broader population of adolescents and young adults who have every range of health and prevention need in this way. You know, it's in what you're describing, Dr. Apandi, the needs to support young adults as they are moving through this transition period. It really is a critical one where you know, whether someone is having issues with mental health or substance use, as Hilda mentioned, whether they're struggling with an HIV diagnosis, whether they're becoming pregnant or able to prevent pregnancies, these, of course, are dramatically shaping options for their future as well. And we all together want to promote as much health and well-being as we can in this. So it's really amazing to see what you've been able to grow through this. Hilda and Victor, I know both of you are working as what we call peer mentors in the system at Moy Teaching and Referral Hospital at the RAFIKI Center. And we really want to, you know, hear from how you as youth are leading in healthcare in this particular way right now. I think that's such a great thing we get to highlight today. And I wondered if you could describe a little bit for us how you've learned to collaborate with the healthcare system. So the RAFIKI healthcare system, the MTRH healthcare system, to transform how services are being provided for youth. I know you play a really special role in that, and I thought maybe you could share a bit about what your role is in that and how you have learned as young adults yourselves how to help other youth to find more support for their health within the healthcare system. Maybe Victor, do you want to start for this one? And then Hilda.
Yeah, I can start.
Thank you.
Okay. We have learned to collaborate in so many ways. First of all, what we do is we act as a link between the adolescents and the healthcare system. And to add on top of that is that when adolescents present with concerns, health concerns, or even social concerns at times, we actually voice their concerns towards the healthcare providers, and we actually have a hand in creating a customized solution for the adolescents so that it may suit them and their needs.
That's very helpful, Victor. Thank you. And I think such a critical role, I think even, I think in our health system in America, similarly in the health system in Kenya, even as adults, even in fact, as someone who is trained as a healthcare professional, these systems can be very difficult to navigate and to find your way through. And I think that's even more of a challenge for youth. And it's such a critical role that you're playing, as you described, giving them a voice, helping them to navigate from one part to another, and that idea of a customized solution or supports for their needs is such an important one. Hilda, would you be willing to maybe also talk a bit about your experience as a peer mentor and working with the RAFIKI Center in that way?
Yeah, thank you, Rachel. We also help in the collaboration of teenage pregnancy girls. We collaborate with the prenatal care, pregnancy care, and linkage too. So we still follow up from the prenatal and come back to RAFIKI. And we also influence and advocate for pregnancy health programs to support those youths in their pregnancy period and also adolescent back in RAFIKI. It really helps a lot and brings the impact of us peer mentorship.
Thank you. So I think for all three of you, this year, the theme for International Youth Day was Green Skills for Youth Towards a Sustainable World. And in that, I think the goal was to really bring attention, as so many youth voices are, to how we need all together to continue to shift towards thinking about an environmentally sustainable, a climate-friendly world, and how the health of our world and climate is also part of our health as individuals in that way. I wondered, as representatives of youth and as you are creating and responding to needs in the RAFIKI Center for Youth, whether you are hearing discussion about creating a more sustainable world among your peers, and ideas or thoughts or concerns that youth have been bringing up about that, even at the RAFIKI Center, and ideas about what that might look like for more of green skills or more health for the world in that way.
There hasn't been a lot of conversation about climate so far among the youth here in RAFIKI, and I think it should be part of the prioritized thing currently. And also, if we think about maybe training on climate health, will really do a lot and understand what it means for the Kenyan youths to advocate for such an environment. And also creating awareness about global warming, which is really an impact to us also, even if we are youth. And I'd also, in general, just advocating about climate and conversation around climate.
Yeah. Thank you, Hilda. Victor, anything you would like to add in thinking about the youth discussion and needs around climate and green skills?
Yeah. If you look at the Kenyan environment right now, and trace back 10 years before, you will see that the environment has totally changed.
Mm.
And lately, a lot of young people have started advocating for the climate, the environment, how to act on conservation on the environment. So that actually creates a bit of awareness among the youth. So I think we just need to create more awareness, and the youth will clearly have a hand in changing the environment. Yeah.
Thanks, Victor. Dr. Apandi, I know in the video it was terrific to see things like the garden at the Rafiki Center, and I know that considering how to support skills development, training, and kind of broader ideas about health are something that the Rafiki Center has been engaged in. Could you tell us a bit about how your work and the work at the Rafiki Center as well have tried to support, you know, youth in developing skills, and maybe in that too, as we continue to think about, as Victor and Hilda were saying as well, how we might you know, even think about how climate health could be grown and supported through this kind of skills development.
Thank you, Rachel. So yeah, I want to agree with Victor and Hilda that when it comes to climate change, we have a lot of improvement in what we are doing at the clinic, because I think we have quite some reach with the youth who come there, but also we do go to schools. Most of our school visits have been around health, and so we could implement a little bit more education on climate change. Some years back, we used to participate in tree planting in schools. And we also used to participate in activities that increase use of bicycles among youth and walking. So yeah, this is a great opportunity for us to think about that again. So some of the skills that we try to empower our youth with, I think one of the most implemented skill acquisition is counseling. Yeah, because the youth at the clinic, basically we task them with a lot of talking to their peers, and in that way they get practical experience with counseling. The peer mentors' role include reaching out to youth, reminding them about clinics, and those who miss their clinics being able to find out why they are missing their clinics. Those who are not taking drugs being able to find out why they are not taking their drugs and participating in getting solutions. Those who have risky behavior, they help in risk reduction counseling. And so counseling as a skill is something that we are really building our peer mentors with. And in fact, most of the youth who have had experience as peer mentors at Rafiki Clinic end up doing counseling as a profession, either at a certificate level or at a diploma level. Some of them end up doing social work. Some of them end up doing nutrition. And so I think it stems from the experience at the clinic. And nationally, our peer mentors have had very good job acquisition nationally, because they leave our facility really built counseling skills. We also have computer skills as one of the skills that we are giving them, because we are able to give them tasks that require computer skills, and most of the time they learn while on duty. And we were even thinking of having a computer lab so that we can have that as a very strategic skills building activity at the clinic. We also do have, we teach them things like public speaking, which I think give them an upper hand when they go for job interviews or when they're with their peers. They are able to mentored on how to handle themselves professionally. So just how to dress and how to speak up, how to interact with professionals. And I think that is very key in their career paths. We also have networking, both within Rafiki Clinic, but also with the rest of the nation. Especially for those living with HIV, they're able to have networks nationally. And in that way, they're able to even get referrals for job opportunities when they get. And then we do have the disclosure, which was a big issue that Victor mentioned, it is one of those things that our youth living with HIV have had a really big challenge with. And we are building their capacity to, especially because of, as they grow, they need to disclose to their sexual partners, but also to their future spouses, and also to their peers as they grow. And so that is one of the key resilience building skills that we are trying to give those ones who are living with HIV, so that they are able to interact with the community with less stigma, at least less self-stigma. But then we also have a little bit of microfinance activities like tailoring, the kitchen garden also. We have had bidding activities before. We used to, whenever there's an opportunity for something like a job opportunity or a manual skill opportunity that we have, then we second our youth there so that they can get some income, as most of them are orphans. And so we do fish around for job opportunities, and we do send our recommendations to them. Yeah, thank you.
Thank you, Dr. Apandi. And I think it really is inspiring to consider how the RAFIKI Center is serving as a model in this way, not only to, try to meet whatever the health needs are and provide the support for youth, but also really thinking about their trajectory in terms of skills that are needed, next steps for jobs, practical training, as you've described, and things that are really helpful as both life skills as well as potentially for future opportunities. And even that, so many of those, especially peer mentors like Victor and Hilda and others, are not only offering and learning skills and counseling, but are in fact becoming part of the very needed workforce to provide mental health support for youth and for others, meeting that very need that that you and that the whole group here is identifying is such a critical one right now globally for youth. So I think it really is a terrific model of not only what it looks like, to respond to disease, but truly what it looks like to support and grow health and all of what that means. Let me just say to our webinar participants today, please do feel free, if there's a question that you want to ask to the group, you can put that into the chat there. And we appreciated the question and response about the challenges of initiating disclosure of HIV status. We know that is a really complicated one, and appreciate Salim and Mark's responses to that from our program as well. It is something that we've worked over time to not only have other youth engaged in full clinic support for, but to really walk families through that process with ongoing counseling and support, and then for individual youth as well, including, one of the things I don't think any of us have mentioned yet is also providing group peer support. So having peer support groups that youth can be a part of, again, for additional mental health support and broader education and support, but that specifically comes from being in a group with youth together in that. So I know that's something RAFIKI does. Maybe a question while we wait and see if there are any others, but a question for Hilda and for Victor. Could you tell us if you could give a message to other youth today about how they can start to make their voices heard, how they can advocate for young people's health and for their well-being? Do you have any advice that you would give to other youth for how they too might be able to make their voices more heard in advocating for youth? Maybe we'll start with Hilda, if you're willing. I know it's a big question.
What I can say to the youths out there, we normally say we are the decision makers, and our slogan as RAFIKI is nothing for us without us. So let no one do something for you if you are not in the decision of making that thing happen for you. That's my message for the youth.
Thank you, Hilda. And I think that's such a critical one, just to repeat it, nothing for us without us in this way. And as we think about what it looks like to provide adolescent healthcare as physicians, as health systems, as researchers, and so on, I hope that all of us, as well as the youth, will hear Hilda's message that we must include youth in this. Victor, what advice might you share to youth who are looking to also become advocates and voices?
My take on that is for the youth in Kenya, we'll normally say in Kiswahili, kujituma, meaning that you put yourself out there so that if any opportunity is around, they can take it fully. And to add on that is that we are young. Youths, we are so young, we are so energetic, and we are so innovative. So the only thing I can say is put yourself out there and believe in yourselves. Yeah.
Thank you, Victor. And I think that's such a great point to note in terms of, yes, like, of course, youth are young and energetic, but truly in that, you are exactly right. You are the hope and the future in this way. I think too often when we're talking about youth health, we think about things we're worried about. And I know we've talked about some of those challenges facing youth today, but it is also so true that you are full of energy, you are resilient, you are full of strength, and there's so much that we can learn from you and that we need to look to you for as well. So thank you. And truly thank you, Hilda and Victor, for putting yourselves out here today with us as well. It's really appreciated. Dr. Apandi, perhaps a last message from you when you think about youth, and I know we've talked about our youth living with HIV, youth with mental health struggles and other challenges, but what is giving you hope as you think about today's youth in Kenya and globally?
I'm very optimistic about adolescent health, the future of adolescent health, not only in Kenya, but globally. There's now a lot of focus on that. We've seen growth in it as a profession, with the universities offering subspecialties in adolescent-related degrees. We are seeing a lot of funding around adolescent health. We are seeing a lot of research. We are seeing governments paying attention. And so I think the youth need to grab this opportunity. As other things come up, climate change and mental health and cancer, I think adolescents, you are in the mix of what the focus is in right now. And this is the opportunity to grab it and run with it. Just as Victor has said, kujituma, just put yourselves out there and run with the world. I think some of us are on our way out. So just take it all out. Thank you.
Thank you, Dr. Apandi. And I might say, as everyone joining us, thinks about how we can embrace this challenge as well. As is put in the chat, we do have information with a link where if you're interested in specifically supporting this work at the RAFIKI Center, we would be delighted to have your financial support as well. In fact, specifically, this youth peer mentor program receives direct support through that. That's a big part of how we're able to have youth like Hilda and Victor who are supporting youth and providing part of these services here. So we'd love to and very much appreciate support for the partnership in that as well. Let me see a final word as we close out here. Maybe I'll turn first to Victor and then to Hilda for any final words to us, both as a global community that is celebrating and honoring International Youth Day together. Oh, actually, I forgot one more thing. So you can think about your final words. One final announcement I wanted to make in our time here. We're very excited in this Kenya partnership between Mount Sinai in New York and other institutions here, and Moy University and the Moy Teaching and Referral Hospital, to be able to also announce as part of International Youth Day that we are going to have some pilot funding available for specific grants that people who are in the shared partnership can apply to try to move forward adolescent and youth healthcare. You will see in the similar emails and notices to information about this webinar, an announcement that's coming out today about being able to apply for some of these pilot funds. So if you have ideas for research, for improvements in care, for ways we can better advocate for youth health, this is your opportunity to apply for some pilot funds to launch some of those great ideas. And not only are there some opportunities specific for faculty in Kenya and as well as at Mount Sinai who are part of this to apply for, but in specific, there are going to be 2 awards made for youth-led projects in this. So we would really love to see some applications from youth who have ideas for how we can continue to move forward better services for youth health in Kenya, how to advocate for that, what kinds of ways we can better engage the community in that, and so on. So those details are coming out, but we're really excited for the first time to be able to offer these small grant awards, both for youth as well as for faculty who are engaged in trying to grow the youth health model in Kenya, and then how that will also apply in other parts of the world as well as we continue to learn from this Kenya partnership. So for our final words today, let me turn to Victor and Hilda again with so many thanks for being part of this session today. Asante Sana for your time, and also for the video and for bringing together the peer mentors around International Youth Day as well. Let me turn first to Victor, a final word for us today.
Okay. My final word is youths are so powerful, and youths can make a change that they need themselves. It's only a matter of putting a listening ear and actually giving them that hand. Because most youths now feel stranded at some point in their life. So they need support. And you should also be able to realize that youths can lead themselves. And youths can actually make so many changes and change the world because they have the power to change anything. Yeah.
Thank you, Victor. We'll take that with us today, that youth do have the power to change the world and to change anything. And Hilda, a final word from you? We're also, of course, happy to see you if you're able to join on the video as well.
Yeah, young people are the lead in healthcare programs and services. So it's upon us to grab it and take it further. That's my message. Thank you so much. I really appreciate your collaboration with the Rafiki Adolescent Center.
Thank you. Thank you. Well, thank you everyone for joining us today. A recording of today's session will be made available through our website. You can find all of our global health webinar recordings on our YouTube channel. Again, thank you to Dr. Apandi, to Victor, and to Hilda for joining us for this session. Thank you to the youth of the Rafiki Center who put together the video to introduce us to the Rafiki Center of Excellence for Adolescent Health there. And thank you across Mount Sinai to those supporting adolescent health, including global youth health, and especially today as we honor and mark International Youth Day. Thank you so much, everyone.